Prostate cancer. Prostate cancer is uh, really simply defined as a malignant growth in the prostate, a tumor of the prostate. Um, it's the most frequently diagnosed visceral malignancy in North American men. It's the second most common cause of death from cancer, behind lung cancer. 1 in 5 American men will end up with prostate cancer in their lifetime. So its mortality rate is fairly slow. It 234,000 cases are diagnosed a year, with 27,000 deaths per year. Um, but this says 1 in 6. Your textbook says 1 in 5. It's someplace in that neighborhood. It it depends on some genetic factors. It seems to have ethnic things. Asians have the lowest rate. African Americans have twice the rate as Caucasians. This is interesting. It says it's more likely to be diagnosed at an advanced stage and more likely to die if you're African American, and it's probably got more to do with socioeconomic status than race. There, it's probably got to do with access to healthcare and basically the cost of it in the states. Uh, I've never seen statistics comparing Canada's rates cross ethnically, and whether it's access to healthcare or not is the common is the factor. So. Uh, so it seems to be related to BPH, but it's not benign. So oftentimes it starts to present like benign prostatic hypertrophy. What happens is a difficulty in flow, and this is a problem because a lot of older guys are quite aware of benign prostatic hypertrophy and expect that flow diminishing is a normal course of aging, and so then don't seek help for their for it, and if it's cancer, then that's it's a problem. Um, it's it seems to have a number of different things. So uh, there seems to be a family history of prostate cancer, but they don't know why. There seems to be that there's environmental factors, there's social factors. Um, so it's complex. How it comes about. Uh, they're saying exposure to cadmium uh, is big. So these are people that electroplate or weld, that kind of thing. Farming, uh, farmers have a higher incidence for for some reason. It's probably got something to do um, with fertilizers or pesticides or something. Maybe there's cadmium in pesticides. Um, High dietary fat intake seems to be correlated. So I don't know. So especially animal fats seems to be it. So a welder that eats a lot of butter and has family members with it are more prone, I guess. Um, so one of the problems of this, so the signs and symptoms are this enlarged hard prostate. Well, that's only noticeable if you happen to have a digital rectal exam. Doctors don't like doing the digital rectal exam. Guys don't like getting it. Guys, notoriously, older men don't go to the doctor for their annual physicals, and maybe they go once every 10 years or something like that. So that becomes an issue. When you palpate uh, prostatic cancer, and I haven't palpated real, but I have palpated uh, in simulation dummies, where you put a prostatic cancer in and a BPH in, and so that you know the difference. When I was in school, some jurisdictions, chiropractic can do this exam. Uh, so we all had to learn how to do it. And the the prostate is enlarged and has a hard lump in it. And generally speaking, the where BPH seems to be the deep tissue surrounding the urethra, the cancer seems to happen more kind of subcortically, like just like near the surface of the prostate. So oftentimes it's like feeling lumps in it. Uh, and because it's not around the urethra, it's fairly late in the course of the disease that you start to get obstruction of the urethra. Um, there may be pain with urination, pain on ejaculation, as opposed to prostatitis, which actually the pain is relieved on ejaculation. Now, the pain happens while you're urinating. There's not a chronic pain with it. Oftentimes, there are no signs and symptoms. They're completely asymptomatic until it's really far advanced. And this is a real problem. It's one of the reasons why, up until very recently, um, we were doing PSA tests regularly. Now, just this year, when I went for my physical, I asked for the PSA test, and they said, no, we don't do that regularly anymore. There has to be signs from the digital rectal exam before we'll order that test, because there's too many false positives on it, and it was getting people worried, and there was too many biopsies. And so cost-cutting measures have really cut that back. I don't know whether that's a good thing or not. But there's often blood in the urine. There may be blood in the ejaculate as well. Can't maintain an erection probably has got more to do with the fact that it's painful to ejaculate. So kind of, I guess it's pointless. Um, it will radiate to low back pain, and maybe even pain down the legs. But the referred pain is to low back, and oftentimes that'll be the first symptom. It's something that you have to have in the back of your mind when you assess anybody with a low back. So it comes out in the history, maybe. Um, really easy to miss. A lot of people have had it for a long time, and it's very slow growing. So you know, yeah, whatever. It's so the blood test is an indicator of risk, but it's not definitive for the disease, and that's one of the reasons why they're not doing it anymore. So if they suspect something, they maybe do an ultrasound, but more likely they're going to do a biopsy. So if it's detected early, then it's quite treatable. My father, it was found on a routine physical 18 years ago, and his doctor said that it was the earliest he'd ever caught one. It was just a fluke that they did it, and they decided, oh, we'll just biopsy it anyways. So he ended up having, he was the first guy in Canada to have a certain treatment for it that I'll talk about in a minute. Um, Apparently, the biopsy is no fun at all. I've taken a number of friends to get the biopsy done because they're not capable of driving post biopsy. It's yeah, it's quite painful because they basically take an eraser size bit of tissue and they kind of go right just in front of the anus there. So um, the treatment is watchful waiting. Now, uh, the if it's bad, they maybe will do a radiation and surgery, chemotherapy, like kind of all the standard treatments. They'll cut out the cancerous lesion, but it has side effects. It's incontinence is the big side effect. The radiation. When I say my dad was the first guy in Canada to get an internal radiation. Basically, what they did was they mapped the tumor, and then they implanted little radioactive seeds right into the tumor with kind of a needle biopsy sort of thing, where they strategically placed these little pellets into his prostate to do it. And it worked quite nicely for about 16 years. He was in complete remission. His PSA was lower than mine. But now it's come back. And he's got prostate cancer again. But he's over 80 years old. And his doctor basically said, we're going to do watchful waiting because the quote, and I thought it was a brilliant quote, was more men die with prostate cancer than die of prostate cancer. This is a disease of older men, and quite often, you know, they do 10-year life expectancies and 5-year life expectancies for most cancers. Well, what's the 5-year life expectancy of a guy that's 85? You know, it's a bit of a problem. So prostate cancer, very, very, very common. You probably know a number of people that have it. It's not something that a lot of people talk about except with their buddies who are of the same age category.